My name is Reverend George Buannie, and I'm a preacher and a women's rights activist from Sierra Leone. I am here to talk to you about what I do, what I believe in, and what for the last 15 years has been so passionate to my life. I work for an organization called Famble Initiative Network for Equality. Famble is a local word in Creole. It means family. The whole idea germinates from the fact that the abuse and challenge, molestation, degradation, discrimination that women face is not just unique to one set of community. I believe it's a global phenomenon. It's a global trend that has raised concern by activists, that has raised concern by women themselves, that is becoming something that our politicians have to contend with. How do we, in spite of all the protocols, international protocols that have been passed, United Nations resolutions that we have had passed, in spite of us coming from the African continent, our respective governments have domesticated these international instruments, but yet still, the dismal statistic speaks to the fact that there's much yet that needs to be done. And I stand believing the fact that the walls of discrimination and segregation that limits and degrade women was built by men, and it is going to take men like you and myself standing here, for the few men of us that are here, to break those walls down. That conviction led me to believe that we have to bring the whole concept of gender equality back in the home, because it is a cradle of humanity. It is the first landing point for every man born to this earth. And if we could be able to achieve that, then the change will begin. Our strategy is simple. Bring men back to school. It is apparently very clear from social scientists and philosophers that men are most ignorant. And the painful side is that we are ignorant of our ignorance. And what we have used to protect that is our masculinity. A woman must not speak when we speak. A woman must bow down where men are gathered. She must be seen and not heard. I come from Sierra Leone, where our records on gender equality is still way behind the present century, way, way behind. We still live in a much the primordial age. I come from a society where masculine dominance, patriarchal beliefs are prevalent. They subdue women. Sexual gender-based violence is on the rise. In recent past, in 2019, my president, His Excellency Julius Maada Bio, was so much tormented by the rise in sexual gender-based violence against women and children that he declared it an emergency. And he ordered a review of the Sexual Offences Act with more harsher punishment so that the cycle and the culture of impunity could be done with. Child marriage is at 39%. Girls are married off as early as the age of 12. And guess to whom? To older men of 40s and in their 50s. FGM is rated at 90%. Teenage pregnancy is on the rampant. And 45% of women in my country suffer from intimate spousal violence. It will also interest you to know that my country has come through 11 years of civil war. And the toll and the impact of that civil war has transformed itself into another war. Even though the war officially ended in 2002, a new war has been opened against women and girls. The war of rape, sexual penetration, sexual harassment, sex for grades in learning institutions. It is a cycle that is being reinforced by masculinity, by traditional strongholds, the gatekeepers themselves, where women are forced to go back into such relationship, to be silent for the sake of their children. I come from a society that was also marred by the Ebola virus. In 2013, the virus ravaged the country of Sierra Leone, and we lost over 23,000 lives. Many were not documented. And in the midst of that Ebola, women and children also suffered the brunt. Schools closed down. And young girls were preyed upon by men. Girls that lost their parents to the Ebola. And fending for survival, men preyed upon them. And we had massive rates of child pregnancy. My country bears one of the worst records of maternal and infant death. 1,163 deaths per 100,000 births. And 35% of maternal deaths is accounted for and attributed to adolescent girls. Girls that are under age, that have been impregnated by men, older men, that could not be able to bring forth children. That's the country, that's the background I come from. That being said, I want to bring you to understanding what spurs up my interest in working with men. It's not only stemming from the part of my call as a clergy, but before I became a clergy, I am a man. And I have a family. I was born into a family. I have seen the pain women going through. I worked with child soldiers immediately after the war. Bringing these child soldiers into a home in the Nehemiah project. It was a Christian-based project from the biblical character Nehemiah in the Bible, who went back to Jerusalem to rebuild the broken lives and broken walls of Jerusalem. And we thought it fit that going back to rebuild the broken lives of those children that were captured by warlords could be the best thing that we could do to begin to reform them so that they could be future leaders, they could become more responsible, that we can reintegrate them into society where they could find their values, their worth, and also contribute. My work with those boys saw transformation. I saw boys that were violent with a gun, boys with vulgar language, boys who had no respect for human lives, boys who could place a bet on a pregnant woman and split her open on whether she bears a boy or a girl. I watched how the lives of those boys were transformed. And that transformation was a key revolution in my life, that society can rewrite its wrongs again in a right way. In 2008, we had the first graduates from the university of child soldiers, boy soldiers, people that were once used to destroy a nation. They were graduates from the university. I turned the project over to them. One of the things I saw was that there were so many boys, so many children on the street that we could cater for. As much as we are a nation that was dependent upon international handouts, but there were more children coming to the street that we could cater for. And I realized that it was time to talk to the men. It was time to talk to the fathers, because these children did not produce themselves. the women did not get pregnant in vacuum. There are a lot of non-resident fathers. Men have abandoned their position of responsibility. And that was how the Family Initiative Network was started. And for me, it was bringing everything back into the home, into the family. That if only the family take its rightful place, they will begin to correct the ills of society. When I started off with the husband school, it was weird. Many people didn't believe what it was. It was like, you mean bringing men back into school? And I had slogans like, it is more better to reform the young than to repair old people. But the gap between the fathers and the children was so huge that children were growing up without direction. Children were growing up without the moral compass for direction. And so we started off the husband school. I know by now many of you are wondering what this husband school is like. Well, for a moment, permit me, Madam Chair Lady and audience, let's all pretend that this is a community way out in the rural setting. And let us agree to disagree that all of us here are men. In the setting where we have enlisted you now as husbands, we start up with dialogue. What is your expectation? And most men will say, my expectation is to learn. Many people will say, well, I'm curious about husband school and I want to know what husband school is like. We begin to engage discourse around gender-based violence. How many men have ever raised a hand on a woman? And many of them will raise their hand. And many of you felt justified doing that. Many of them, we are sadly justified doing that. They will ask a simple question. How many women in this community are beating their husbands? And it's quiet. No woman. How many women in this community have ever been caught in the law for raping a man? No. And as this discussion goes, we begin to bring them to the realization that, do you know that when you raise a hand against a woman, you're really raising hands against somebody else's mother? Or how would it feel if you come home and meet your mother bleeding from the nose and the ears saying, a man beats me? And you will hear the response from the audience. You will hear. Some men, we swear. Some men will say, I'd rather die in the prison, but I'll kill such a man. No man dare beat my daughter. No man dares beat my mother. But then do you know that when you beat your wife, you're beating another man's daughter? Do you know that when you beat your wife, you're beating another man's mother? How many men here do accompany their wives to access health services, to the hospital? No. How many do give financial support to their wives to access medical health services? No. As men, we impregnate them. They have to fend to the hospitals for themselves. And this is one thing that happens. In farming communities where workers have to go on the farm and the woman has a doctor's appointment and comes to tell the man, he goes, well, you know, we have workers going to the farm today. Who is going to cook for them? And that woman will forego her medical ANC appointment and goes to the farm. Men are not willing to give financial support, but they can give the financial support to the mortuary when the woman dies. They are not willing to accompany their wives to the hospital, but they can accompany the dead corpse of their wives to the cemetery. And by the time we have started the engagement with them, and also bringing to the fact that gender-based violence does not only affect women, it also affects men. Many men are on the run from the law. They can no longer provide the leadership to their families anymore because of one mistake. The children are growing in vacuum without the leadership of the father. Resources that were meant to have been used meaningfully In building the family life, supporting education and the welfare of the children is now being spent on court cases and on medication. We also challenge the destructive behavior pattern of men. And our husband schools are also supported by professionals. We work in concert with government line ministries. We have gender ministry officers who come to conduct. We engage with the policymakers. We train community male advocates and peer educators on legal policies and reforms. One of the huge gaps that we experience in our country is that there are so many laws and reforms that have been made, but they are there in the shelf. And go down to the rural communities, people had little or no knowledge about it. We engage with the gatekeepers, the paramount chiefs, the traditional leaders and religious leaders. We work through legal aid to develop bylaws, and we sign MOUs with communities. For every community that we walk into, we sign MOUs. We train these MAPEs, male advocates and peer educators. They are there at the community disposal. 24-hour monitoring the system, 24 hours raising awareness, 24 hours engaging men at household. Our program specifically work at household and community level, specifically, because that is really where the action, the abuse is. These mates are working 24/7 around the clock. And we begin to see the wheel turning. Are there men that will pose resistance to our interventions? Yes. Many of them pose resistance based on religious ideologies. But we have a way of going around that. We use the principle of everybody knows somebody, and somebody has a friend. And we use that cycle of influence. In a country where there's religious tolerance and people have respect for their religious leaders, we walk through pastors. We work through imams. My programs manager is a Muslim, and I'm a pastor. We work together perfectly well. We break the resistance, and we're beginning to see the tides are turning. In my country, FGM, it's not a man thing, it's not a thing men should talk about. It's a woman thing at 90%. But I'll tell you that in communities where we are working, the tides are changing. As recent as in January, I give you a case scenario that 2 girls came out from school, and on their way home, they were abducted by some of the Suis. Suis is a local language for the FGM initiators. They were abducted. And 2 hours later from school, they have not reached home. And the father raised an alarm. And in space of 30 minutes, there were over 80 men that were gathered at the paramount chief's house demanding that those guys be released on court. They passed the night there, and the next morning, they were released on court. That is what happens when men stand up to protect their daughters. That is what happens when men stand to protect their wives. Men are accompanying their spouses to the hospital now. We have the free healthcare in our country, which addresses pregnant women and lactating mothers of under 5. They receive free medical treatment. Prior to our intervention, when women are tested positive for STIs, pregnant women, and they come back and tell. Now, we are all men here still. We are in the husband school. Imagine your wife comes back, and we are all, appreciate that we are all from Sierra Leone. The wife comes back to say, I tested positive for STI. The natural inclination is, where did you get it from? The natural thought is, she must have been running around. And in most cases, that has resulted to violence. But with our intervention in the community, it is no longer like that. Men are now showing up with their spouses for treatment of STI. And that way we are breaking the chain of transmission. We are saving lives, we are changing attitude as well. I will give you brief statistics on the achievement, the impact that we have had at the community level. Since our marriage with VSO in 2015, it was from our community gathering meeting at every district level. There's often always a monthly meeting. And in that monthly meeting in 2015, we learned that there was an organization in Sierra Leone called VSO who was bringing in midwives that was supporting the district health medical team in building confidence in women to come back to the hospital. Mind you, we have just come out of Ebola, and the confidence level of women to use the health centers was very low. A lot of them risked their lives with TBAs, traditional birth attendants, who are unskilled, untrained, ill-equipped, and operate in a more unclinical environment. When we met with the VSO team in one of the rural north communities, and we learned that they were bringing V-scan machines, and they were bringing midwives, I took the bold step to find out more about VSO. And our marriage relationship was a 4-month pilot. 4 months. Did I just say that? 4 months. And from 2015 to 2020, we are still in a 4-month relationship. We saw the change. We saw the impact. Institutional delivery, clinics that were abandoned, women begin to run to those clinics. Hard to reach communities where government will say we don't have the resources to go. With the V-scan and with men leading the way, we are able to enter those hard to reach communities with those V-scans and bring back the result to the DHMT team. Currently, we have over 6,000 men that have been trained through our husband schools. And those who graduate are called lead fathers in the communities. They now work with the stakeholders in the community to ensure that there's no beating. You don't beat your wife in the communities that we work. Domestic violence for us is not just a family thing, it's a community thing. In Binkolo, for instance, you beat your wife and she cries, she runs out. You have over 10 women in an immediate neighborhood, they have their pots and clanging that pot together, and you have hundreds of men running to that place. We have this community preventions, response mechanism being established and being strengthened. Men are resolved to ensure that no woman suffers domestic violence in the community that we are operating with VSO. We have 725 men that have been trained as MAPEs that are placed at community disposal. 725. They are placed at community disposal. They are raising awareness. They are enforcing the MOUs and bylaws that have been developed. They are engaging men at household level to ensure that we are creating the environment for equality. Ensure that women are accessing health and services and they feel empowered and emboldened. We have about 180 adolescent youths in 9 boys' clubs. We're also working in schools. We address school-based, gender-based violence. We're working in schools. We are addressing the issues of sex for grades, especially with male teachers that are harassing female students. We have boys trained in those schools. We also have had about 60% reduction in domestic violence. And we are beginning to see the enhancement of harmonious living between husbands and wives. Men are now reporting to their wives on how much they earn and how decisions are made about that. I don't know about the UK, but in Sierra Leone, it is hard for men to tell their wives how much they work. But that's changing. It's changing. Because that is one of the reasons why men die early. And we have so many widows. Because you allow all the pressure and the responsibility on you. And you ask African men, what does your wife do? She does nothing. Well, we ask them at the husband school, your wife does nothing. Okay, good. Do you have a security home? Do you have a cook? Do you have a cleaner? Do you have a caretaker home? And they say no to all of these things. We say, well, do you know that not only in the Western world, but in the city, in Freetown, people who do these jobs are paid? So how much are you paying your wife? It's a simple, logical approach to changing men. Because, as I said, men are ignorant of their ignorance. And the defense line often always is our masculinity. It's changing. We have seen 70% of men providing leadership and mentorship for their adolescents in the home. Through our Pamama program, Pamama is one of our local programs coined from Papa, Mama. It's an idea to bring husbands and wives together. If we're advocating that women must be heard, let's take it back to the home. Because for the empowerment that has been done in Sierra Leone, resources that have gone into Sierra Leone, women must be the richest in my country. Sadly, it is not. Because the woman has received empowerment and she comes back home under a president called husband that is so ignorant of his ignorance. And whatever the woman says, he sees it as an affront. He sees it as a confrontation. With engaging men, the tides are changing. We have increased institutional delivery, and men are accompanying their spouses. Men are testing voluntarily for STIs. We have men on data that are ready to donate blood. Peradventure, there's a need for a woman. VSO has funded us. We have started what we call the Village Saving Loan Scheme, but it is also gender integrated approach with livelihood. And that is really changing the economic landscape for families, financial empowerment for families. We have increased up to 45% of family planning intake, especially in strong Islamic communities, strong religious communities, people that by their religion know family planning is a haram. A woman that takes family planning is quote unquote stigmatized as promiscuous. It's changing. We're changing there. We have, currently as I speak, we have 440 men that are enrolled in our husband schools going on in Sierra Leone. Our partnership with VSO has been a game changer. It's been a game changer. And with the work that we have done and the success that we have made measured at impact DHS level, I'm glad to declare to this house that this gone Monday, which was the IWD, the International Women's Day, the president of Sierra Leone declared the male engagement as a national strategy in fighting sexual gender-based violence in Sierra Leone. Because they have monitored the program and it's working. It's producing results. The president had no option. The gender ministry had no option. And now male involvement has become a national strategy. And I'm very proud of my partnership and my work with VSO, because they have helped to accentuate, to bring to the outward level that as a nation we ought to engage. My challenge and plea, though, is that the donor perception will change. Because for a long time, donors have focused on the feminist approach minus male involvement. We believe in feminism. We believe in the approach of empowering women. But we also believe that men must not be left behind. For those of you, we are living in a technology-savvy age. You can watch Empowering Women, Don't Forget Men. You will see a pop-up on your phone. And that brings us to the point that in 2013, Fine Sierra Leone was the winner of the Global Resolve Award on Reproductive Health. The initiative is working. As I close on this personal note. I believe in what I am doing. As a father of 4 beautiful girls, 2 of whom are now in the university, I want to see my girls grow up to be respected for who they are. I want to see them grow in an environment that appreciates them, in an environment that they don't have to negotiate their values. That is my passion, and that is what I believe in. Thank you for listening. Thank you for your audience.